Log on to NationalGuard.com.
Sponsored by the Florida Army National Guard. Aired by the Florida Association of Broadcasters and this station.
What you want to know. What you need to know.
Talk 1470. WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, Florida listeners, and all the listeners out there. This is Lou Biazzi filling in for David DePino. David's on a well-deserved vacation, and tonight we have a real interesting show. As you know, You and Your Doctor Live Longer and Healthier has been sponsoring a lot of shows lately for the last 2 years, but tonight we have a very special guest. We're going to talk about home health care. Really, what is home health care? And we're going to be talking to an RN, a registered nurse, has been doing it since 1995. Her name is Deanna Baron. And welcome, Deanna.
Thank you.
Thank you for coming.
Thank you.
And, you know, Deanna, we've been in the home health care business for 25 years. You've been in it since 1995. And a lot of patients really don't even know what home health care is. So when a doctor orders the home health care, they say, well, what does that mean? Does that mean someone's going to come to my home? And sometimes they refuse because they really don't think they want someone in their home. Mm-hmm. Now, Deanna, you run across that. What is really home health? What does it do? What is it? How does it help the patient?
Well, it allows the nurse goes in, and we can be the eyes and the ears of the doctor. I can go into someone's house. I can see if they're taking their medication correctly. I can do a safety evaluation, look around their house, see if it's being kept in a way that's safe, or are there things where they could possibly fall and injure themselves. Frequently, the referral is made after someone has come out of the hospital. So they're on new medication, they may be dealing with a new diagnosis, and it's hard to learn everything you need to learn about that when you're sick and in the hospital. Once you're home and you're in your own environment and your own life, then you can sit down and learn about what this new illness is that you may have, what the medications are, how you can avoid complications, things like that. Sometimes they order a nurse because someone has just put on some new medication. And rather than have them go to the doctor, 2 or 3 times a week to see how they're doing, we'll go in every couple of days and monitor them and make sure that they're doing well with the medication.
So you're talking about medication management. You're doing some medication management.
Right.
Now, what else do you do? Do you do any wound care? Is there any wound care? Is there any physical therapy involved or occupational therapy involved?
Yes, there's wound care, which wounds are, it could be from diabetes or from vascular insufficiency, mm-hmm. or it could be a wound from a surgery that maybe is not completely healed yet and still needs to be bandaged at home. We do diabetes care. for people who are newly diagnosed or people who their whole medication regime is being changed. We teach nutrition. We do safety evaluation of the house, physical therapy, occupational therapy, speech therapy. The speech therapy includes dysphagia, which is swallowing. And we also have a social worker and a home health aide come out and help them bathe.
That's fantastic. So the other thing what we're talking about is when you go into a home, and sometimes these elderly people, they're a little apprehensive about having someone in the home. Mm-hmm. And we're finding that sometimes people say they want to refuse home health care.
Right.
Well, is it your recommendation that if home health care is ordered, they should accept it?
Oh,
as much for their benefit?
Yeah. I mean, I tell people you've paid into Medicare your whole life, and now you should be able to make use of it. And your doctor obviously feels that you need some additional services, and they're ordering it. We don't go in unless it's ordered by a doctor, and everybody is bonded and licensed, and
Now you've been in it since 1995.
Correct.
In home care, realistically, you're working with the doctor with a plan of care. So we're not doing this on our own. The doctor has to approve everything we do and every change you make. Am I correct?
Absolutely.
So you're working with their physician.
Yes.
So you're the eyes and ears of that physician for that patient while you're in home care. Mm-hmm. And if there's anything that you notice, do you call the physician right away?
Immediately. Any change in a person's wound status, in their vital signs, their weight, anything that could indicate something is not right, we would call the doctor immediately.
And I'm sure, because since you've been in it, I'm sure you saved many lives, because sometimes you had a 911 them, they were taking a stroke or they were doing something that you came across. And without you being there, they probably wouldn't be alive because you noticed it. And
I'm not sure of that, but yeah, I've called 911 numerous times, and people have gone to the ER.
Right.
And
so you're a safety check as well as being an RN. You taking their vital signs if you see something is wrong. Mm-hmm. And one of the things is when you do a home assessment. Mm-hmm. Now, do you do a complete home assessment? Now, one of the biggest things I understand, I got in this business many years ago because my dad had dementia. Mm-hmm. And my mom was on a walker, and she couldn't take care of him, and the doctor ordered home care. I had no idea what it was. And when they came in, my mother was a little apprehensive. So the next day I called. I said, "Ma, how you doing?" She says, "I love the nurse. It's fantastic." And basically, for the caregivers, for the family caregivers, the respite custodial care, the home health aid side of it, it's like a godsend.
right.
So when you're saying to me, if you see something in there, and you see a patient has a wound, but you also think they may need physical therapy or occupational therapy, you might suggest that additional care and ask the doctor to write an order for that. Is that correct?
Right. Well, frequently the doctor knows that the person needs services, mm-hmm. but they don't really know exactly what they mm-hmm. need, and they want us to go out and assess and see what the needs are. And so I can, I'll look at the house, as I said. A lot of times people have the scatter rugs and things like that need to be moved because you can fall. And as you may well know, a fall is frequently the beginning of the end for many elderly people.
So we're really doing some fall prevention.
Heavy-duty fall prevention.
So you're doing heavy-duty fall prevention. You're looking at the refrigerator to make sure they have sufficient food. Mm-hmm. And the house is neat. It's in a good livable condition.
Right.
Now, if you find that they need assistance with maybe some food or some other assistance, do we put a social worker in?
Yeah. We would immediately have a social worker go out and assess the situation, see what social services are available for them. With the patient's permission, we'll call their family, and because especially down here in Florida, so many people, their kids are up north, and they don't really know, what is exactly going on. So
sometimes they're a little frightened, so they want family members to get involved.
Right. Well, it's important that family members get involved because we can't take care of them for every day for the rest of their lives. What we can do is identify the need and then put in place the services and get the family involved. The family, we are there not only for the patient, but for the family.
So when you go in and you start a case with a new patient, now there's a certain protocol that Medicare requires, isn't there? Mm-hmm. I believe there is, right? And that protocol consists of you doing a complete, what they call an OASIS form?
Yes.
That OASIS gives all the information to Medicare and letting them know what the patient's situation is, and those notes, you get doctor's notes, you get all these things. So you spend about an hour and a half in your first visit just filling out OASIS.
Yeah, usually at least. We have them bring out their medication. Usually say to them, whatever pills that you're taking or what, just show me what you have. And, they get the shoe boxes filled with the vitamins and things like that. But we'll go through everything and make sure that there's not a duplication of medication, that they're not taking things that are expired. And that they understand their medication regime, because a lot of times they go to more than one doctor and sometimes they're not talking to each other, and
there could be a duplication,
right,
which could cause more harm.
Yes,
right. So in that OASIS form is then sent to Medicare and then filled out and all, and you get a plan of care is done that goes to the doctor,
right, and
the doctor approves it and says, let's follow that plan of care, and you follow, and if there's any change, you notify the doctor,
right.
All these services you provide, patient must think it's going to cost them a lot of money. So it's really, is how do they pay for it?
It's 100% paid for by Medicare Part A. So yeah, even if they have supplemental, I tell them that's good. You should have that, but it's not necessary.
So the supplemental doesn't even come in.
You don't need
to.
So
no. Medicare Part A covers their total cost. It is basically you being in their home 2 or 3 times a week, making sure they're maintaining their proper schedule, making sure they're taking their right medication, and making sure you're in contact with the doctor to see how they're progressing. Mm-hmm. Now, you tell me why, if with all these services, if the doctor orders it, make sure, you seniors out there, make sure you take the advantage of what Deanna has been telling you, because there's nothing more but for benefit for you. And, a lot of times I'm in the office and I'll see someone says, well, we refuse it. I don't want it. Refuse it. We don't know any reason why they would refuse something if it could benefit them, right? Now, you have to make a decision even if they qualify for home care.
Right. There's a certain eligibility requirement. Right. You have to be homebound.
Homebound.
Which means that you're not leaving your home for anything other than to go to the doctor, church or temple, or the beauty parlor. And a lot of times people don't have, they're by themselves. So if they are the only way that they can get to these places, then it's still considered homebound if they have to drive and get themselves to those places. But we're providing services in the home because it's too difficult for them to get them any other way.
Now, you mentioned the home health aide. Mm-hmm. So if you feel the patient, because they just had surgery and they can't help themselves with the bathing or the ADLs, you will recommend a home health aide, and home health aide can come in here 3 times a week.
Yeah.
And that, again, is at no charge.
Right. It's part of the whole package.
So they're getting a complete package. They're getting a home health aide, they're getting an RN, they're getting a physical therapist, an occupational therapist, whatever they need for those services. Now the question is, why do the doctors want to order home care? Because they feel they want to get them out of the hospital, I think, faster, and they can do more at home. And do you find, with all the years you've been doing this, do the patients sort of recover better at home?
Much better at home. And also to keep people from having to be rehospitalized. Mm-hmm. If you teach people how to manage their chronic diseases, then they can prevent themselves from getting into an episode where they need to be rehospitalized.
Now, you've been working with All County, and I think All County now has come up with a program for COPD.
Correct.
And you've applied that.
The IPV.
Mm-hmm. It's a pulmonary percussive ventilation.
Correct.
Okay. Now, you see a lot of COPD patients. Knowing that COP is not curable.
COPD, yep.
It's a chronic disease, right? But how does this IPV that we're trying to institute in the community to let people know there is something now that can assist them, how has your outcomes been when you've been using the IPV machine on these patients?
It's Very positive. What the IPV does is it's a positive pressure airway, bursts of air into the lungs, and it helps shake mucus off of the lung tissue, and it helps expand the lungs as far as they'll go. And in cases with COPD, when portions of the lung are no longer elastic, this can keep them going for longer. It's really the only way that you can exercise the lungs tissue inside your body is by using the air, inhaling it. And we'll listen to their lungs before and then after, and the difference is unbelievable.
And my understanding is All County is the only agency that has this instrument that basically goes into the home, which sometimes they get the same treatment in the hospital. It's a continued care. Mm-hmm. Now, through our whole exercise with this IPV, hospitals now have been calling All County. What they want to do is they want to help decrease the readmissions.
Very much so. Now,
readmissions are costing Medicare and costing people millions of dollars a year because, when you have chronic lung disease or chronic COPD, sometimes you're in and out of the hospital multiple times during the course of a year. Mm-hmm. And they really want to stop that. If they can stop it, that's a cost savings factor both for Medicare and keeps the cost down in Medicare, which we're trying to do, so that we can maintain our Medicare position so the cities can maintain Medicare. Mm-hmm. Now, a lot of people, today, and this is another thing, you've been in this since 1995. I'm a senior. I'm on Medicare. I'm not knocking any other insurance companies, but a lot of seniors, they say, oh, I want to try this Medicare Advantage. Mm-hmm. I get calls every day when people get sick, friends of mine get sick, and say, my mother's sick, what can I do? And the first thing I ask them, what kind of insurance they have.
Right.
And somebody says, well, they got Medicare. Well, we come to find out they have a Medicare Advantage plan. That's either with Humana or AvMed or some other company.
Managed care plan.
Managed care plan, right. Mm-hmm. Right? And the difference is that under a straight Medicare plan and a managed care plan, you keep the patient on for 60 days under the Medicare guidelines. Is that correct? That episode is 60 days. So you don't have to worry about the number of visits they get or what they don't get. Now, I know a lot of companies question how many visits a patient gets. Now, do you feel you've been with All County for how long? You're permanently with All County now, right?
Yeah, it's been like 8 years. I lose count, but it's quite a while.
And how do you feel that company addresses patient care?
They're the best company that I've ever worked for.
Well, you're not being biased, are you?
No, but they really are. They're very fair. They'll give the patient what the patient needs. I've really never, been told you have to stop making visits for this person.
Where some companies say we limit them 5 visits or 6 visits, what they shouldn't be doing.
Right.
So you give the patient what they need.
Yes.
So the question is, and I know All County, they very seldom turn down a patient, no matter what the cost may be, because they may lose some money on that patient. Because we also, I think we've taken quads, we've taken quadriplegics, where no other company would taken them. So All County doesn't segregate who they take. They basically will take any and all cases that are given to them.
Right.
Because that's the way Medicare should be, and that's the way the management thinks. They think they want to take any and all cases, and we don't restrict any of our people from, I think, OTs or PTs or nurses, RNs, LPNs, from number of visits. Whatever they give, whatever they tell our case manager what they get for visits, and that's what we give them, correct? And the other side of it is they need a home health aide. The home health aide goes in there at a cost factor. Again, this is free. This is part of the Part A Medicare program. And under the Part A Medicare program, there's no out-of-pocket cost.
No out-of-pocket.
So, this is a tremendous asset, and what it really does, it manages your care while you're at home. In Medicare, if you're out there and we're talking about not knocking managed care, but if you have a choice between managed care, and from your perspective, I'm sure you did some managed care, would you suggest that the seniors stay on straight Medicare?
Yes. In fact, I have frequently worked with them on getting off of their managed care and back on the straight Medicare, because the managed care dictates your care. They're going to tell you what company you can use, because they'll have a contract with one company or another. And the company that provides your home care, that's patient choice. That
Right.
should be the patient
Always
choice.
a patient choice. Mm-hmm. So, one thing All County does too, I think, and one thing All County does too, I think if you're doing a wound care and the doctor orders a medication that's very expensive, you have never seen a generic medication. You've seen always the medication that the doctor orders.
You mean like a dressing?
Dressings that the doctor orders.
Correct.
So what we're saying, we try to we comply whatever the physician orders and what he says. Okay, this is what's got to be done. So we're always following those physicians' orders to make sure that patient gets healed better, whether it's wound care, whether it's IPV, whether it's physical therapy, whatever that may be.
I mean, we may make a suggestion and say, there's this other product that is in the same family as the one that you've recommended, and through my experience, it works just as well, and it's more cost effective. And the doctor will say, okay, try that, but we would not do that without a doctor's order, because we're all trying to make things more cost effective.
Right.
So,
and what happens is, we do a tremendous amount of wound care.
yes.
Wound care is one of our specialties, and All County does a tremendous amount of wound care. And the other factor is you've been in it since 1995. You work for a number of agencies around town. And one of the things we always do is we always say, okay, when you go in, you do a complete home assessment. And one of the things that we do a little differently, we have a patient handbook.
Right.
When I say we, All County Healthcare, has a patient handbook.
Yep.
Now, that patient handbook is like a Bible. All right? Now, that's what we call our company Bible. That gives the patient any and all kinds of information. Am I correct, Diana?
Yes.
Diana, what kind of information is in that book?
It's a very, very good reference piece, and it's got information on living wills, on safety in the house, on infection control, on interactions between the most commonly used natural supplements and common medications, and it just goes. It's got pages of phone numbers of the services, social services available. It's a really, really good publication. Let's see, the whole section on fall precaution,
Right.
prevention. It's really.
Now
The hurricane. We're in hurricane season. It's got a whole section on hurricane awareness and how you sign up for a hurricane shelter and the lists of things that you should have to be prepared.
Listen, this is something that should be on every senior's desk, on every senior's bedside, so they can review it all the time and let the rest of the family members see it. So if you want one of our patient handbooks, call us at 954-717-7027, and we'll try to get one out to you. Whether you use All County, you don't use All County, we think this is a great Bible that everyone should have. And, and not only is it a great Bible, it's a piece of material that really will assist you in any situation you have. It has all the kind of numbers for ARCA. It has all the number if you want to make a complaint, if you want to call the police. It's got police, fire, everything you need in this handbook. This is something that every senior in every household should really have. And we would, we're not giving them out. We're giving them out to you if you need something. Give us a call. And I said, Deanna's been in it since 1995 in home care, and we really got to thank these nurses, these RNs, these PTs, these OTs that go into the home, because as much as you might want someone in your home, it's very difficult sometimes for them to go into a home. They go into some good areas, they go into some bad areas. And we really got to be thankful for people who are doing home care. Many years ago, people say, well, how did home care start? Well, it started with the Social Security Reform Act of 1993 with the Social Security Reform Act, where Johnson signed into force, where they said, we're going to allow Medicare to come in, and if you retire, you're going to be able to have insurance now with Medicare. And that's what everybody's arguing over today with health care. The biggest issue today that we're seeing out there between the doctors and the home care agencies and well, I guess we have 2 minutes, 2 minutes, am I correct? You're telling me I have 2 minutes left. So what I'm saying to you, home care is something that it's a benefit to you. it's a major benefit to you because this controls you while you want to be out of that hospital as fast as you can because of MRSA, etc. And we got to thank these nurses, these RNs, LPNs, home health aides, PTs, OTs, going to home. It's not an easy challenge. And they're basically saving lives. They're helping you get better so you can basically get back into your community, get back to being healthy. And they're doing this all under the doctor's basically direction. So, Deanna, of all the of everything that you come across, right? Now, you highly recommend if a person gets home care in order, they should take it.
Absolutely.
They should take it. It's to their benefit.
Yeah.
Okay. And the thing is that, again, Diana will tell you that the IPV treatment, if you get COPD, call us. Deanna may come to your home. He's yelling at me because we have one more minute left, but we'll get all the information we can. If you want something, call All County Healthcare, 954-717-7027. And if you're lucky enough, you might get Deanna Baron. But we have a number of nurses that are all excellent nurses.
It's a really good team.
It's a great team. And I got to tell you, the team is out there, and from the management on down, the case managers, everybody's pushing good care. Good quality care. Remember, home care is your choice. Not the choice of a physician, not the choice of a case manager. It's your choice. So if you're hearing us today and the doctor's going to order home care, remember, it's your choice. And you heard us on the radio, call 954-717-7027. If you need any help with your health insurance and you want to talk about what the Medicare Advantage plans are versus Medicare, we'll even help you with that. So anything to do with home care, we're out there to help you with. And that's it.
That's it.
Thank you all.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.